Well, there's a lot of similarities between the two, but the real biggest difference is what's filling the implant. The actual shell, both of them are made of silicone. Sometimes it's smooth and sometimes it's textured, and we'll talk about that in a little bit as well. But in general, this would be a silicone implant. You cannot vary the size of this. You can, of course, buy a different size, but I can't fill this with more or take any more out. Versus, say, a saline, which starts as an empty little sac. We fold this up and we then tuck it into incision, let it open up. We are able to put a little fill tube in, and then we can fill this with saline, and we can fill it to not any volume that we want, but within usually plus or minus 50 cc's or so. The biggest difference between the saline and the silicone kind of is their performance. These silicones definitely feel more natural. These salines are a little bit more blottable or palpable, so you can feel these more. In general, if someone has got a B cup size breast or better, I will usually push towards a saline because they're a little bit cheaper, and when it ruptures, you know, because when it pops, it's salt filled with salt water. You're just going to simply, your body will absorb it and you'll just pee it out in the long run. Now the silicone, when it ruptures, it can go for years without you knowing that it's ever been ruptured. Turns out you can see a rupture on a silicone implant about 30% of the time. You can see that sometimes via ultrasound or sometimes via mammogram. So when someone is smaller than a B cup, I will usually push for the silicone because it's going to hide better and it will ripple less than a saline implant.